hello everyone. This is Razia Mishkoor here. As we know that coronavirus is changing the way we live our lives. Let's hear from experts who are fighting the coronavirus on the front lines. We have today Dr. Shams Iqbal. He is joining us from MGH. I would love to say something about him. Dr. Shams Iqbal is an interventional radiologist at Massachusetts General Hospital, Boston. He is the Associate Chief of Division of International Radiology and has appointment at the Harvard Medical School. He is expert of image-guided therapy with a special interest in developing new treatments for cancer like liver and kidney cancers. He is expert of imaging and imaging-guided novel treatments. He is well published and has spoken around the world. His latest focus is on minimal invasive treatment of prostate enlargement. Welcome at BDC, Dr. Shams.
Thank you, Rajeji.
First and very important questions that have in every minds these days is how are medical professionals dealing this coronavirus these days?
First of all, Rajeji, thank you for having me in your interview, and I appreciate it. This is a very difficult time, and we should call it like it's unprecedented time. Usually in medicine, we learn from past quite a bit. To compare something of this kind, of this significance, we have to go all the way about 100 years ago. And it's hard to like have a sense of what we are facing. So we are like, it's a very difficult time, and we are like harboring a lot on simulations of what we have right now, what we expect, and how to prepare for it. So as you know, like the coronavirus started in like I'll go a little bit in the background. Like coronavirus is not a new virus. It's a family of virus which has a look on electron microscopy which gives a sense of like a crown. So they are all known as coronavirus. Corona means crown in Latin. So there have been like multiple episodes of similar things like SARS, MERS. Every few years it has started since 2000, and every few years we'll have attack of those. The issue with coronavirus, the present coronavirus, the virus which was detected in 19, which we are all knowing as COVID-19, coronavirus disease 19, is like it has a very long latency period, high infectivity, and long latency period. So what's happening is like people don't know that they have this virus, and they have been assimilating with everyone, and a lot of people are getting the virus before even they realize. The half-life, like it's about you must have heard the like 2 weeks time. So once you get infected, and by the time you totally get clean of it, is a 14-day period. During that 14 days you can infect any number of people. And it's a very complex situation, so we don't know where we stand in terms of infectivity. And unfortunately in the West we felt that we have won the battle on infection, so we have come a long way, and we have decreased herd immunity, unlike the eastern part of the world. So this is going as a negative downside for us, because everybody has low immunity, and anybody who touches and the persistence of this virus in air is quite long, unlike rest of the viruses which we are aware of, like influenza and other viruses which we are very well versed with. These things make it like a perfect combination of something which can persist in our system for a long time. The problem arises, again, it's also okay as long as we know how to control it. Like we don't know how to control it, number one. We don't have a vaccine, number two. Number three, we don't have a treatment. Number four, we don't know its natural cycle. So there's so many unknowns, and the way it's affecting the people who have predisposing conditions or predetermined conditions, it's a nightmare for healthcare. And like we have been like bracing up for this since a long time, and a long time in a sense couple of weeks, which feels like a long time, because we are living and dying, living and waking up with the same thought all day long. So
Yeah.
it's very stressful. Like in short, if I can say that.
It is. I mean, as you said, it's very stressful. So yeah, you are doctor and you are saying this. So we, the people, common people, we are more scared more than you guys. So
Yeah, I
what would
understand.
you
I understand.
suggest, or how can people infected with the current coronavirus, how you being treated them?
So here's the deal. Like as I already mentioned, so there's so many unknowns.
Hmm.
We have seen patients who tested positive for coronavirus COVID-19, and they had hardly any symptom. In about like 2 weeks, they are good. On the other extreme of the spectrum, we have people who have tested like they had some, we have the way we are testing, there are like certain prerequisite. You cannot, we don't have enough testing.
Hmm.
We have certain limited number of testing, so we have certain prerequisites which is required to for you to get tested. You need to have
Hmm.
like high fever, you need to have a dry cough, you need to have uh, uh, you need to have like sore throat. These are a few things which we look for, and if we see they are positive, then only we use a test on them.
Correct.
So people who have these, let's for sake of example, like I'll tell you example, like last week we had, there was a 18-year-old guy who got better, and on the other hand there was like a 70-year-old person who tested, like he came in with the symptoms. We felt that he fulfills the criteria, and like it's the testing is also evolving. uh, till last Friday, it would take 3 days for the test to come back results.
Hmm.
So we tested the other guy, and before the test result come back, he was dead, and he came back as positive. So we know that the cause of death is coronavirus, but we came to know posthumously. So the problem is such a varied presence and presentation. This is very hard. So the right in a utopia, in a perfect world, we should be able to test everyone. We should be able to get the results very soon, but we are not there yet. We could have done a little better if we would have started a little earlier. I know, not pointing fingers to anyone, but the authorities should have reacted a little faster, a little sooner.
So we
Uh,
we are late to start or believing things or rumors
yeah,
coming from around the
you
world.
know, you can judge it by the fact that so all the things which we talk about right now is based on a simulation uh, curve which is deployed, which is like, there we ran a simulation on 100,000 times, that how many people are infected, how many people are going to be more infected, how many of them will be sick, how many of them will be seriously sick, and how many of them will be needing ventilator. You must be hearing about lack of
Right,
ventilators. So
right.
it's not that everyone who gets COVID positive will get ventilators.
Yeah.
What we are looking at, the fraction of people who get, so and we don't know any of those because we are
Yeah.
just learning every day. It's a very fluid environment. Every day we're learning things. So what I was alluding to, the fact is, like, initially when we were doing the test, it took roughly like 10 to 14 days to get the result back, because all the tests in the entire country was sent to CDC.
Hmm.
CDC will run the test and give you the result back. Then
Oh,
they delegated the test to the states. Then the state center will do that. And now we are at a point, like as I mentioned, like last Friday, MGH has developed their own inbuilt system that they can run the test in-house, and the testing resulting time has shortened quite a bit, and this will be huge help, because like the problem with that sick patient was, like there was, I was reading about one of the article, like there was a young kid, a 17-year-old, who had such symptoms. He went in, he qualified for the test, he got the test, but he there was not much going on, so they sent him back home.
hmm.
And 3 days, 4 days later, his results come back, and he's like, oh, he's positive. He was brought in, but by then he had already infected his 70-year-old parents,
We got,
and they
we
are
got.
very sick. So the problem is, like, this lack of the speed. We are working at different speeds, and if they don't match, it's difficult to have a hold on the entire situation. So that's what again, like, not blaming anyone, but we are trying to do our best. For example, like the way we are preparing is like MGH. We usually have 90 unit beds. In unit, by unit we mean that patient who can have a ventilator.
Hmm.
We have a contingency plan right now in which we
Hmm.
are using all hands on deck, and we
Hmm.
have set up a plan in which we can have 400 ventilator bed in the hospital, which is more than almost half of the hospital will be ventilator beds.
Wow, that's
So
nice.
this means like we're using all our resources towards this, because we know by simulation that we will be reaching the peak of the curve, which where New York is right now.
Right,
We will
right.
be reaching there in about a week from now. So
Hmm.
we are calling it the surge. Massachusetts is waiting for the surge, and we are all like the physician group, the whole like healthcare providers, we are bracing for it, and we are
Wow.
scared that we might not be enough.
Oh my God! Because yeah, there is so much in here about next 2 weeks. So,
Yeah.
what would be your strategy to deal with the next 2 weeks? What will happen? How many people will? Hopefully not, but who knows what happened in next 2 weeks? So, what will
Yeah.
be your strategy to deal with these things?
Yeah, that's a huge unknown, and that's what makes it scared, because we have seen countries which took these things lightly. For
Yeah,
example, Italy took it
yeah,
lightly and they paid the price for it.
yeah,
Spain, to some extent, did the same. We like, as a country, we can say that yes, we did take it a little lightly, and New York is in a very difficult situation.
yeah,
So Massachusetts has been lagging like at least a week to 2 weeks behind New York. So we are bracing for it, and as I said, already mentioned that like the way we are preparing is like we are trying to optimize the resources in a way that we can maximize the. So as I was mentioning, so what are we really scared of? As I already mentioned, the spectrum. In
yeah,
one side of the spectrum, you have like young, healthy patients who without even any treatment, without even getting admitted, they get well.
yeah.
On the other extreme, there are people who right away go from like totally normal to within a day, they are totally oxygen dependent by ventilator.
Mm.
So that's where the mortality is the highest. And we need to control that to control the mortality. And that's what we are focusing our energies on. Those patients who have pre-existing condition, those patients who have weak immunity, those patients who have already have cancers and all those things, where their body cannot fight, they have already like lung fibrosis. In these patients we will need those, so we are trying to do a simulation of those. And I if the simulations go right, we will be in difficult situation in 2 weeks. I don't
Okay.
think we
So
have
let's
enough.
say the people who have the weak immunity, and the people who are already have taken some medicine for
Yes.
different health issues, like say ARB.
Hmm.
So what would you say about them?
So that's what I would say. Like, please maintain social distancing. Please wash your hands. Please,
Yes.
because it's an unseen enemy. And the
Yeah.
problem is like, if you want to take people of these pre-existing conditions and low immunity, if they want to risk the things, it will be too late. We might not have enough resources to save them, and to the extent that we might reach a point where like New York, like Italy, where they have to decide that one ventilator, three patients,
Mm.
and we are in essence we are signing the death certificate of the two people who we are not giving the ventilator to. But the problem is like we only have one ventilator to give. It's not for the lack of heart, it's the lack of resources. So
Resource.
please maintain social distancing. This is how we can beat this virus. This is how we can decrease transmission, and this is how we can control, because again we are not trying to exclude the disease will be there. There's a way by which you can manage if the curve is flat and you have a certain number of patients all the time, and we have resources for that. But if there's a peak, we are not designed to manage the peak. We cannot,
Oh,
simply cannot.
all
That
right.
is a big giveaway.
So that's why people are so scared, and they are sitting there back their homes. But still, so many things we need to go outside to buy things, and then so for next 2 3 weeks, would you suggest that people stay home?
I
Uh,
I would say get out only if you really need it. Number one.
mm, mm.
Number two, if you get out, if you have gloves, please wear gloves. And when you come back home, before you enter your home, throw that gloves away. So
Okay.
that whatever you have on the glove surface, either you wash it with soap or you throw it away. Because the reason why I don't want to throw it everything, because there's a scarcity.
Yeah. Yeah.
There's a scarcity of everything. So wash. Use some hydrophilic compound, which is like lipophilic compound, which is soap.
Yeah.
Soap. makes the surface of the virus, the protein, all disintegrate. And
Mm.
that's how you, and you have to wash it and to reuse it. If you wear a gloves and you go and touch things around and you again touch it, it's no different than touching with your hand,
Yeah.
unless you use the gloves as a protective device. So be very cognizant. Think about it, what you have touched, and at the end, what are you not going to touch. So if you go touch the fruit, touch your grocery, take things, but when you come back, the first thing you should do is go to the bathroom, wash your gloves, put the gloves away, then take the stuffs out without touching the outside of the bag, and then throw the bags away.
Okay,
This
so
way, you never.
one question is coming in my mind. But so many people, they are not using gloves, but they are going to buy things or groceries and things, and they are touching everything,
Yes.
right? And then the same thing, I mean, the same thing the other guy can buy. So, so how can we save our lives because somebody touched that grocery bags and everything?
It's- So
It's like,
I understand.
yeah,
The key here, there are two things. One, the government has been issuing, if you go to the stores, you will see they say, like, if you touch anything, please buy that thing. They have been saying that, number one.
okay,
Number two is like, uh, we cannot eliminate infection transmission.
right,
Elimination is a word which means zero transmission. We cannot have that.
yeah,
What we are trying to do is minimize it, because there's a need to live also, and to live you need to have all these, like grocery stores, medication, and everything. That's also needed to live. So you do your best, your cognizant best, think about it, and then try to do the best, and try to minimize the contact, and try to minimize the handling of stuffs which we call fomite transmission. And this is the best you can do, because and that will, as I said, like, we are going to flatten the curve. We are not gonna exclude the curve. So if we are conscious about this, cognizant about it, we will decrease the number of sick patients.
okay,
Again, we cannot eliminate it. We have to accept that fact.
yeah, okay. So like people says that if you have diabetes, if you have high blood pressure, you have more chances to get it really soon than other healthy people. Is that
uh, yeah, so
or this
people
might?
with people with diabetes and hypertension, these are like chronic diseases of lifestyle.
Hmm,
They suppress your immunity, so they fall in the same category. So they don't take it quick. What
okay,
we are concerned about, like, they will have severe disease, the group which might need ventilator and pulmonary, like, cytokine storm, severe disease progression, multi-organ system dysfunction, and then probably eventually lung failure, and then death. So those are the people who are at high risk. As I was mentioning, I was alluding to the fact by saying pre-existing conditions. So these are pre-existing conditions. If you have diabetes, you're
yeah,
bound to have low immunity, because your body is fighting with the glucose all the time.
yeah.
Hypertension, similar things, not to that severity as diabetes, but similar. So these people are like high risk, so they need to avoid the contact as much as they can.
Perfect. And after talking, I'm expecting, and I believe that USA is ready for as much as they can. We are ready to fight next 3 4 weeks. As much
Yes, I hope
opportunity.
so. I would love to agree with you. Yes, we
Okay,
we
that's
we are
really
we
good.
are getting there.
We
The
hope.
the issue is like, there's a lag time in, so we did ended up using the Defense Production Act. So a lot of emphasis is based on developing new ventilator system, new PAPRs, new PP. So one of the biggest issue we have is like our personal protective equipments were not enough. So we are trying to somehow manage that, because if you use the same mask and if we have to go from one room to another, we are doing the same thing which we are trying to you not to do.
Yeah.
We cannot lead by example unless we have enough supplies. And we were lagging a little behind with that. Now that a lot of like people have joined forces, everybody's trying to pitch in. I think China is up and about with like in America is like very dependent on the supply from China. They are up and about and they are supplying. It's a little like finicky to
Yeah.
except like what quality they are. But again, like at this point in time, we are taking one day at a time. We are not being very finicky with the quality control. We are trying to get as much as we can, and especially the N95 mask. There's a definite distinct shortage of the N95 mask. The mask which is the best support for virus infection. It's like you might have seen. It's like a round thing with a pinch at the nose.
Yeah.
That's very much required for like I was doing few cases on COVID positive patients yesterday, and I was very concerned because in one of the case we did not have the N95 mask because I was at the covering the smaller hospital. But again, luckily it was a non-aerosol generating surgery. So they're like we have divided our patients into three categories: aerosol generating, which is high risk;
Okay.
non-aerosol generating, which is very low risk; and the middle one where there's a possibility that they can generate aerosol. The first one is like when we, for example, we put a tube in the mouth, we put a tube in the nose, we are directly interacting with the mucosa, and that's where the virus is sitting. So those are very high risk. We have to have total precaution. We sometimes we use a PAPR, the positive airway respiratory system also. So we are trying like there are a bunch of committees who are forming to maximize, like now we have all hand on deck. Radiology is like, so I belong to the surgical side, but my counterpart who only do imaging, they
Yeah.
don't do much clinical work, they're paraclinical. But in this time of need, they
Mm.
have also been sucked into the floors. We
Wow.
are working on the floor because that's the need of the hour.
Yeah.
You my We give all our physician assistants to the ED because ED was swamped. ED cannot manage. They don't have enough hands. We
Mm.
gave up our like residents. We gave up our fellows, and soon, like probably from day after tomorrow, we might also be working. Like I'm already working on the floors, but we might be part of a couple of additional committees and teams, which is rotating on the floor for our skill set. For example, placing a G tube, placing a nasal tube, and all those things. It's here, it's scary, and it's real.
Yeah. So, no, thank you so much for giving this information, and I'm sure that people listen it and follow the doctors and what the administration is saying.
Mhm.
Again and again, and every day they are calling and emailing and everything. I'm just because we both are from India, we both are alike. In this situation, the same happening in India too.
Mhm.
Uh, what do you think about India and their? I mean, that is so hopeless. But
It,
what do you
it's
say?
so my take is like two things. One is like I'm really scared
Yeah.
because I don't know what kind of path this virus will take. Because if it takes the path of the West, India is doomed. Because India has a population of roughly more than four times the US, and
Yes.
resources they're like not even 1%.
No one
So
person.
it's but there are few hypotheses, as I already mentioned, it's a very fluid state. We keep a open eyes and open ears to the publications around, and there are few publications which have been showing that there are few things which might help the situation of India. One is like they have a huge herd immunity, which I initially mentioned in the discussion that the West won over the battle of infection, but
Yeah.
over time, what happened, like you don't have the immunity to fight anything because everything is so clean and neat. You don't need the immunity.
Yeah.
India, because of just the sheer way our lifestyle is, there's a distinct advantage of having herd immunity. Number one, I don't know if it protects it, but that's a definite advantage. Second is like there was another article published yesterday which mentioned that India has an advantage because there is a generic immunization with BCG which cross reacts. I
Okay.
hope that study is true because if that's true, then like vast majority of the Indian population will be protected.
Yeah.
And the third philosophy is like which we have been seeing. This is like observational study where you see things and you say like, hey, this is looks like something different. There's like all the malaria endemic places have low severity of diseases.
Oh.
India falls into the malaria endemic area, so that's
Mhm.
also a thing. And the fourth point which helps them is like uh, temperature. Historically, viruses have been like, as you know from flu experience, the viruses get attenuated during the summer period. India is already entering hot temperature. The temperature is already above 35 there. So the virus might be attenuated, which means weakening in layman terms, and might not have the enough strength to infect
Mm.
people. So these again, these are big hopes, big questions, but observational studies have been showing that the probably India might not get hurt as bad as we are getting hurt, and
Okay.
as Italy and any other advanced countries. But only time will tell. We can only
Yeah.
pray for India, and we can do the best we can in any form, way, or means, please.
Absolutely, absolutely. No, no, this is very good. And hopefully, we all, East or West, people are living in such conditions, whatever that land offer us. But yes, we hope and hope these 3 4 weeks passed and
Definitely. Definitely.
they were good for everyone living
Yes.
here or anywhere.
Hmm.
So wishing the best to everyone, and thank you so much for having uh, that chat and giving us time.
Oh, no,
Thank you so
no
much for
problem.
having it, and we will call you back soon.
Thank you. Thank you.
Because
Stay safe.
I'm saying so many questioning coming up. So I just took one question about the ARB, but I'm seeing so many questions coming up. So I will put all these questions and we'll come back, call you
Definitely.
one
I'm
more
happy
time.
to help. Stay safe, keep safe distance, and keep washing hands.
Thank you
Good
so
luck. Thank you. No
much.
problem.